Any questions? Yeah.
If you recommend a fluoride topical rinse, is there one that doesn't have a dye, the green and blue one? Is there one that's more organic and without dyes?
That's a hard one because for simplicity, we always recommend, some Act because it's so cheap. And it's, and that's, I know that Listerine Natural has one. I think it's clear. I'm pretty sure that they've just come out. I think, Jill, did you say the zero? Is that the, yeah. And that's the thing. When would you advise a parent to give fluoride treatment to a child? I mean, it's very hard. If a child is developing cavities, there are natural ways to try and reduce the cavity load. I mean, and again, and that young man that was only 8 years old that had a mouthful of decay, well, we might want to rethink that. So every situation is very, very different.
What is zirconia?
Oh, zirconia. So what exactly is zirconia?
Is it a plastic?
It's a mineral. Yes, that's
like
I like a mineral, zirconia, mineral. Yeah.
It's not like the composite.
It's not a resin or a plastic. No. Mm-hmm.
And it is not a metal when it goes through the process.
And is my partner, dentist.
It's not a metal.
Well, it is on the elementary table as a metal, but when it goes through the process of creating the implant, it is not a metal at that point.
What about whitening teeth?
Mm-hmm. Very safe. Yeah, very safe, and even the Crest white strips, they're very effective. There is power whitening, it just has a higher concentration, but it can cause more sensitivity. But whitening is too much of anything is not safe, so we always recommend it, maybe a touch-up once every 6 months or once a year.
Drinking lemon in water first thing in the morning after oil pulling is
it's dilute.
From so many perspectives. Is it safe?
I don't have a problem with it. I mean, they have also found that type of acid does not seem to be causing cavities. It can cause other things, erosion, attrition of the teeth. But again, you're diluting it in water. You're not sucking on lemons. So
it could stimulate salivation.
Absolutely. Absolutely.
You say to drink it through a straw.
And there you go.
Yeah. It's better to stick it through a straw.
Can you talk about the worst plaque being near the saliva glands?
I'm sorry?
The worst plaque tends to be near the saliva glands.
To talk about the worst plaque being near the salivary glands?
I'm sure he's talking about calculus on the
lower
lower anterior.
Yeah.
I said plaque, I meant tartar.
Yeah.
Low anterior.
All right. So when you would like to talk about it?
Oh, it happens to me. I just want
Yeah. That is absolutely right. The mineral deposits on the plaque, yep. And so they have to get scraped off.
Why does it happen? Is that a question why?
Yeah, well.
Well, you have salivary glands underneath your tongue.
Yeah, there's
And yep. So that's constantly producing new saliva, and your saliva has a higher concentration of calcium salts and ions. So when they harden, that's where they become stuck. So because that's where a lot of your saliva comes from, that's why those bottom teeth in the back have the most buildup.
Okay.
Can you do
All these smart people. That's my hygienist. Yes,
I was growing up in the Philippines, the older people chew betel nut, and the betel nut and also the leaves. And I noticed that they have good teeth. Even though the teeth are discolored, but they did have good teeth.
Betel nuts. I don't know about betel nuts. Oh, I have to write that down.
But it's,
betel nuts?
They make your teeth.
It discolors the teeth?
Terrible.
Oh, nobody's going to go for that.
Maybe there's a secret ingredient.
There's lots of healthy things that unfortunately... Yes.
I have many questions, but how important is it to remove your amalgam fillings?
I get that question a lot. How important, again, depending on your health, your condition, in a healthy person, do you have to? I mean, it's very controversial. I mean, mercury in your mouth, if you can get it out, but there's a lot of expense that goes into that. So sometimes what a patient will choose to do is take out one a year if they have insurance benefit. As I said, if you're a healthy person. You know, if you're not a healthy person and you're seeing an integrative physician, it might be a totally different situation. But I do not like to advise a patient, you have to have these out, or, oh my God, you're going to have, you know, MS or some other, you know, we don't know. So I don't recommend, ethically, I wouldn't recommend taking them all out. But when you can, I don't have any in my mouth, but when you can do it, if you can do it one by one, that's great.
Can I comment on that one too?
Please.
So I appreciate, you know, doing it at a pace, but, you know, the newer data is really showing that all autoimmunity is linked to toxicity, and that is particularly with heavy metals. So if it's in your mouth, you may be healthy now, but if you want to stay healthy until, you know, happy, healthy, dead,
Dr. Cardani is an integrative physician that we work with. Yes.
Live our lives. It really behooves you to remove those amalgams when you can.
Perfect.
I'm confused about coconut oil. Is coconut oil solid?
Coconut oil, as soon as you put it in your mouth, it dissolves and becomes a liquid very quickly.
And is it necessary to do that first thing in the morning?
That's the most effective time. That's what they say. That's what they say. Ayurvedically speaking is the most effective time.
Scrape your tongue first.
And you could scrape your tongue. Yep.
If you have an amalgam filling, I heard, or is there any risk if you do the oil pulling that it could leach out any of the mercury and you'd be kind of swishing it? I know you eventually spit it out, but
Right. Well, typically the vapor from the mercury vapor is usually released when you're biting with your upper and lower teeth together. I mean, I have not read that the vapor is released when you're oil pulling. So I don't know if I can comment on that. I just haven't read that. So.
thank you.
Do you have an approach to TMJ? I think I saw it.
Yes, an approach.
And a little, can you?
An approach to TMJ, if a patient has TMJ TMJ has a multifactorial etiology and a very strong psychosocial component. It has a neuromuscular component. So there's a lot that goes into it. So it's very difficult and that really has to be looked at when a patient is sitting in the chair and we look at their bite and their muscles and psychological history and that kind of thing. So that's a tough one. Is there a specific, okay.
Just, kind of like you have an approach to people who have cavities. I'm going to give them a dietary
mouth guard. I see, a mouth guard. Many patients who have TMJ are clenching and grinding their teeth, and we usually will recommend a mouth guard, which takes the pressure off of the joint.
I've seen it respond amazingly to Reiki practice. Self-practice is well streamed. I saw a young man who was about to have serious surgery because he'd been suffering for so long, been through many dentists, not you, unfortunately. And within I guess he started practicing 3 months before he was supposed to have a surgery, and the surgeon said, you don't need it.
Wow. And craniosacral, I think, is
That would make sense.
Well, with TMJ, we do refer a lot to we use many different modalities, and Reiki being one of them, or many with chiropractic, acupuncture, massage therapy, because it is, as I said, multifactorial etiology. So yes, Reiki, yes.
You were talking before about, was it with, the root canals, and that you could still get bacteria in these little, whatever they cracks.
Right, the lateral canals.
Okay, lateral canals.
Yeah, that's okay.
Now I'm wondering, with dental implants, I've always had this impression, I have one, that between the stem, you know how they have the cap, and then there's that stem, isn't there a space up there that can collect?
We have bacteria in our mouth, and it's always collecting. We've got good bacteria, bad bacteria, but when you are able to keep your mouth very clean and you're in good health, Generally, you know, it does not impact. If you are going to have an implant failure, there are reasons for implant failure. I think that's maybe what you're referring to. Why would your implant fail, maybe is the question. Because bacteria in your mouth is perfectly natural. So if you're, you know, concerned about failure of your implant because of the bacteria up and around the gum line, you know, that's a different situation.
Not to get real personal here, but I noticed that if I take dental floss and if I wrap it around that implant and, you know, do this, that it has a smell because of accumulation of whatever up there.
Right. And so something like that I couldn't comment on, not, of course, seeing your mouth. That would be a very difficult thing
But
to
I mean,
comment
I
on.
have to keep that clean, really clean.
You do have to keep it clean,
Yeah.
really clean. That's,
More than
yeah.
the rest of my mouth.
Well, because of the structure and the anatomy of the bone is different than around your natural teeth. So you usually have more of a concavity around an implant. So you do have to clean it a little bit more vigorously. So yeah, so you do have to use maybe a thicker floss or some kind of interdental cleaner to get it as clean as your other teeth because of the structure around a dental implant.
I'm sorry to pester you something. The inside of your mouth is an ecosystem, right? Am I looking at that right? Well, you mentioned 2 bad bacteria, right? 2 specific, you isolated 2. Are there any ecological approaches to targeting just those 2 species with a mouthwash or?
Well, generally, you know, we don't want to destroy all the bacteria in our mouth because of the ecosystem. And interestingly, sodium hypochlorite, interestingly enough, it'll kill the bad bacteria and will repopulate the good bacteria.
So you already said yes to that question?
Yes. I know when I say bleach, everybody is, but actually the studies have shown that it repopulates the good bacteria and increases the population of the good bacteria.
Would that type of rinse be more effective in patients that get chemotherapy and radiation therapy for preventing mouth sores and all the things that go along with the immune?
Well, that's a good question, and I can't comment on that because I haven't actually thought about it.
Oh, okay.
So I would not.
We recommend baking soda and water rinses.
Right, which is simple,
Yeah.
of course. I would have to think about it. I would hate to answer that question without, yeah. Anybody else? Good, thank you.
Thank you.
You're welcome. Thank you very much. I appreciate it.